NHS staff in Scotland suffer 35,000 injuries in 3 years. NHS staff in Scotland have suffered more than 35,000 injuries at work over the past 3 years. Figures from the Scottish Liberal Democrats showed injuries included bites, needle wounds and falls, and also covered stress. The party's health spokesperson Jim Hume said it was worrying violence against staff remained high. The Scottish government said criminal proceedings against anyone who assaults a staff member was encouraged. Continue reading the main story. Injuries 2011-13. NHS Greater Glasgow and Clyde 9,583. NHS Borders 7,114. NHS Lothian 6,355. NHS Grampian 2,808. NHS Highland 2,413. NHS Lanarkshire 1,621. NHS Dumfries and Galloway 1,558. NHS Fife 1,209. NHS Forth Valley 1,114. NHS Ayrshire and Arran 816. NHS Tayside 644, no figure for 2011. NHS Shetland 69. NHS Western Isles 57. NHS Orkney 11. MSP Mr. Hume said, whilst our health boards operate vigorous accident reporting and prevention systems, we know that accidents can occur because of potentially unsafe behaviour or conditions. Our figures have shown that NHS staff in Scotland suffered over 35,000 injuries whilst at work over the past 3 years. These include injuries from needles, stress and slips, trips and falls. It is worrying that violence against staff also remains a high cause of injury. Injuries come at great cost to the running of our hospitals, but more importantly they can cost lives. Ministers must work with health boards to reduce these injuries. A Scottish government spokeswoman said, all health boards are required to provide a continuously improving and safe working environment that promotes the health and well-being of staff, patients, and the wider community. The recent nationwide NHS staff survey shows that staff working in Scotland's health service feel increasingly positive about the overall experience of working for NHS Scotland. Unfortunately, evidence shows that incidents of violent and aggressive abuse are a serious factor for healthcare workers, and this is clearly unacceptable. We actively encourage NHS Scotland organisations to commit to supporting criminal proceedings against anyone who assaults a staff member.